So I read an article a few weeks ago in Forbes about post-corona corporate reinvention and recovery checklist. There are so many things that companies have to be mindful of, and I thought it would be good to pull it all together in one document that companies could use to guide them. And then I have some best practices for each of those. So I'm going to go through that first. And then I wrote this book called Catalyzing Innovation. I just updated it and added a lot of examples of innovation that I've seen from coronavirus. Unfortunately, necessity is the mother of invention, and a lot of really interesting innovations have come out of this kind of dark period. So I'm going to go over those, and those will focus primarily on the healthcare sector. So I don't need to reintroduce myself, but the only point is I've worked for a lot of companies. I've consulted and spoken across industries and taught and guest lectured in a lot of different places. And so it's given me just a lot of insights across sectors globally, and I draw on those. I have 4 mini brands, and Steve also talked about those: the Inventors program, the book, marketing and new product consulting. And I started a conference regarding the latest in digital marketing from all of the top digital marketing platforms. But right now, people are not that interested in going to conferences, so I'm reinventing myself to some extent. Anyway, so regarding the post-coronavirus corporate reinvention and recovery checklist, I'm going to talk about and give you examples in these 4 areas. One is, I think almost every company is trying to figure out how to minimize human and physical contact and utilize their space differently. Also, getting noticed if you're a new product and launching. With less retail presence, I believe it's more difficult for new products and services to get noticed, so that's a challenge. Also, digital, because of less physical presence, digital is trying in every way that it can to replicate the benefits of physical in-person dealing with customers. And then the last area is making the website user interface more intuitive and navigable, really optimize the online experience, making the content more complete, informative, and fun, so that visitors can find what they want quickly and easily, so that they'll return often and stay longer. So that's, these are the areas that I'm going to explore now. So number 1, minimizing human and physical contact and utilizing space differently. Contactless delivery. In the past, many times you have to sign for a document, which means being in close proximity, touching the same pen as the delivery person. Someone came up with the novel idea of having the delivery person leave it by the door, ring the doorbell, and then he goes away and takes a picture of you receiving it. So just kind of a creative way of overcoming that obstacle. This may not be new news to people, but if you go to the Nike House of Innovation in New York, there's a locker towards the door, very close to the door where you would enter, where you can order online in your office or your home and then just come and pick it up. Walmart has a similar feature where you pay, you scan in the store, right at the front of the store, and then it comes down in this like elevator with your goods. Carvana, they've changed their marketing tagline to the safer way to buy a car. Not only can you buy it from the car vending machine, but they'll also deliver it to your home. And then Amazon is doing a lot, which they've been doing for a while, with ordering online and picking up in store. So just some examples of vending along the exterior of stores. Another thing, I was recently in Singapore, and just an example of vending machines. This was a very unusual vending machine in a middle-class neighborhood, but the world's first Norwegian salmon ATM. Literally, you could buy fish from a vending machine that was a very high quality, imported from Norway. Similarly, in upstate New York, there's a very high-end butcher. It's a 24/7 butcher, and they have lamb and chicken and beef and all different types of meats, and it's very, very high quality. Again, you just go in and you don't need to deal with any humans. Robot delivery. So a lot of companies are experimenting with this. I know, I think Domino is experimenting. This is a burger chain, but having robots deliver food. In the healthcare sector, and I saw this in Taiwan. This is another company, I think it might be US based, but using robots in hospitals to deliver food or to deliver medication. So again, you have less contact with humans, human-to-human contact. Another aspect is 3D printing. So you can if you can manufacture yourself in your own location, you don't need to deal with receipt of goods. And then curbside pickup, you know, we've seen a lot of that. Starbucks in many areas is delivering coffee from the window. We're seeing lots and lots of places doing that in the New York area. This is Nordstrom in Manhattan, curbside pickup. You know, all different types of stores are doing this. Lowe's types of stores are doing it, high-end department stores, coffee shops, etc. Also in the area of contactless, you know, we're seeing more and more companies. So this is not new, but what's new is that more companies are rushing to get the technology. So being able to pay remotely from your phone, contactless, or contactless credit cards. And then 6-foot distancing issues. You know, we've all heard about that as well. The issue for companies is it a turn off? Do people see a line and think, I know there's a Trader Joe's near me and you have to get there super early and there's an incredibly long line and that's a turn off for me to stand there. So how do you keep social distancing and move people through the lines quickly? And then also restaurants. I just went to my first restaurant in a parking lot of actually quite high-end restaurant Saturday night, and it was delightful. But you know, that's a challenge, and there are weather issues, and you can't do it year-round in New York, etc. But that's what obviously people are thinking about for distancing. Protecting employees, so we're seeing more and more PPE and barriers being erected. It doesn't seem to be hurting, you know, the experience very much. Everybody kind of understands. And then requiring masks. And I was just talking to Steve. It seems in Tennessee, it's kind of a mixed bag of whether people are wearing masks or not. In New York, we've done a remarkable job of lowering the infection rate and hospitalization rate, quite astonishing. We started the lockdown too late, which was very bad, but we've done a very good job in terms of disciplining the population. And Governor Cuomo signed legislation that stores can reject people who don't wear masks. So it's really been enforced here. And again, that's being done to varying degrees. Changing office layouts. So many offices are having to you know, spread out. They're doing a number of different things in order to do that. One is physically moving the desks, as I'll say on my next slide, but they're staggering what days people come in, what times people come in. Same thing with elevator use, so not everybody's cramming into the elevator at the same time. And then partitions in offices like cubicles. I remember having a cubicle 40 years ago when I first started working. And then testing sanitation and the staggering of times at the locations, as I mentioned. Schools are also looking at staggering. I'm going to talk about what they're doing in Scandinavia to keep students apart in schools, but you need more space to do that. And then just sanitizing, so hiring more crews, buying more sanitation products, etc. And then testing in the workplace. And there's a lot of discussion about legal issues, who is liable if employees get sick in the workplace, and it's not really clear cut, and there's expectations of lawsuits, and it's quite challenging. So there are a number of companies, and I'm sure you've heard of this, but a lot of the tech companies now, I heard Twitter said they may never go back to the office. And many of them are saying not until at least the end of the year. So that's obviously going to be a very big change of, you know, will we ever get back to the office? And if not, we'll be much more selective about the meetings we have and when people come in. And then changing store layouts and traffic flows. So that also, you know, is an issue. It's slowing things down a lot, which has economic repercussions. If you have lower capacity in the store, you have, you know, fixed overhead, and what is that going to do to the economics? It's better than nothing, but it's still, you know, an issue. Okay, so the next area is getting noticed as part of category discovery with less retail presence. So right now, I personally believe that it's much harder for startup brands and new products to break through the clutter unless they have massive marketing budgets. What we've seen, and these are a couple of headlines from the Wall Street Journal recently. One, that comfort foods have made a comeback. in the coronavirus age, that big brands that were doing poorly, because overall with e-commerce, a lot of traditional stores were losing sales, and traditional brands were losing to farmers market and online startups in terms of food delivery. But now we're seeing brands like Heinz and Kraft and Kellogg and mayonnaise, ketchup, things that are just kind of old comfort foods coming back, and they're having huge increases. So this was now a headline. The first two from the Wall Street Journal. This is the New York Times. I just need the comfort. Processed foods make a pandemic comeback. And this is Chef Boyardee that has a 50% leap in demand because it's shelf stable, it's inexpensive. That's another thing with people being laid off, their budgets are constrained. This is just examples of physical discovery, but there have been studies done, and I've seen anywhere from 70% to here's almost 87% of shoppers who make decisions in store. There's a lot of impulse purchase. You know you want to buy a category, but you're not sure which brand, what size, whatever. And so you stand there for a while and you look at what the alternatives are. So without a retail presence, it may be harder to really, analyze what all the options are across many different categories in a shopping trip. Okay, the third area is how can digital replicate the benefits of physical? And this is just showing, this is since coronavirus, 7 categories that have growth of over 50% versus prior year during the period. And you have leisure and outdoor, which is up 139%, auto parts and tires up 79%. That's probably because people are relying less on public transportation. Electronics, they're doing more home entertainment, up significantly. Alcohol and cannabis, not surprising, people are drinking a lot more, smoking pot a lot more. Comedies and collectibles, home goods and decor, and general merchandise. So this is they call it BOPIS, buy online, pick up in store. And that's also what you're seeing a lot, that there's been a 208% increase in buying online, picking up in store, and a 49% increase in online sales. All of this is obviously reducing the amount of time people are spending in stores. And the physical retail percent of omni-channel shopping as a result is declining. And the aspects that physical locations provided consumers that digital will strive to replace include human interaction for advice and information and reassurance, the ability to try out or try on and determine fit and performance of products, the touch and feel of clothes, mattresses, etc. Verification, like, identification, signing, notaries, things like that. Healthcare exams, healthcare tests, and the immediacy of going in the store and walking out with it. So these are the things that I'm going to address some of them with some examples. So touch and feel, there's a phenomenon which you've probably heard of called showrooming. And it's basically saying that 35% of Americans use their phones to check out better pricing or to order online even when they're in the store. The categories with the highest levels of showrooming are consumer electronics, apparel, books, and you can see, going down. And then the retailers that have the most showrooming are the large, this is a little bit old, but because Toys R Us has since gone bankrupt, but PetSmart, Bed Bath & Beyond, Best Buy, Kohl's, Target, Costco. So again, there's less of that going on right now. So you're not having the ability to go in the store, check it out, and then buy online. And virtual try-on is something that's, again, this is how to replace the physical experience. So with Sephora online, you can scan your face and then you can try on makeup. In some cases, you can do the whole face. You can do the makeup, the blush on, the eyeshadow, the mascara, everything. Warby Parker, they've had this for a while, but these are features that some of the pioneers initiated, but more and more companies are rushing to implement. So again, being able to scan your face and try on glasses And then they send 5 to the home so you can try on a number of different pairs and return them for free. Direct to consumer brands. So you've probably heard of Casper, the mattress company, and they're a unicorn. They've done quite well, but they have open bricks and mortar stores, and they found that number one, it's important for awareness. I heard the co-founder speak, and he said that they don't budget, they don't look at the ROI for the store based on sales in the store. They budget it out of the awareness budget because it helps people become familiar with their products and services, and then they may go home and buy it. And they found that for cities where Casper has introduced retail stores, sales are growing 100% faster than markets that don't have the stores. So again, the ability to the detriment of not being able to go into stores has hampered companies. This is Everlane, which is another unicorn that is very highly regarded. And their CEO was quoted in September as saying that basically no online only companies are profitable. And so all of these stores need offline. So again, this is something that brands are struggling with. And even when the markets open up, there are going to be fewer customers per store. This particular store was so crowded. I've never seen this before, but you got a buzzer as a customer. Like if you ever went to a restaurant and your table wasn't ready, they'd give you a buzzer and you go outside and wait till your turn. They literally would give you a buzzer till the try-on room was free for you to come. So again, they're dealing with much lower capacity and the lack of benefit of people trying on the goods to order later. This was a study in Harvard Business Review, and it's basically saying that the more channels customers use, the more valuable they are. And so according to this study, after controlling for the shopping experience, customers spent an average of 4% more on every shopping occasion in the store and 10% more online than customers who only bought in one channel. And that customers who use 4 or more channels spent 9% more in the store on average compared to people who just bought in one channel. So again, we're dealing with more limited channel options, and so that may have a detrimental effect on sales. And then in terms of employees in the store, so part of having social distancing is having fewer workers in the store that don't need to be there. So with computer vision, auditing of inventory and noticing things like, is the item in the right location? Is the inventory low? Is the promotion pricing consistent with what's in the flyer? These kinds of things that previously had been done by employee can now be done by computer vision. I should say another example of contactless shopping is Amazon Go, and Amazon is extending that to the grocery industry, and they'll probably be implementing it in Whole Foods. Okay, so this is my fourth trend, and that's making the website user interface more intuitive and navigable. The content more complete, informative, helpful, engaging, and fun. The objective of every website is to get people to come as often as possible, stay as long on the site as possible, and buy as much as possible. So improving the online experience is very important. So that visitors, find what they want easily. They don't spend too much time doing it, and then they want to return because it was a good experience, and they want to stay because the content. Many websites are becoming like magazines, and they're having a lot of editorial and customer lifestyle types of commentary. Okay, so just this section is quite short, but the website user interface and content, making sure that navigation, that it's very easy to find the products and the information, that the loading time of the site is very fast, because anytime people have to wait, a certain % leave. The user experience. So Gucci is doing video calls with salespeople. This is very challenging for luxury goods. How can you create a luxury experience? So they're doing it with salespeople. Bonobos, which is an online men's clothing retailer, does it with ninjas. So they've got very good chat bots. Easy payment, one-click payment. I already talked about the editorial. AI recommendation engines, because again, if they can understand your tastes and make recommendations to you, it increases the likelihood you'll buy. Quizzes, asking you questions so that they can recommend the best products for your needs. And then making returns easy. And then having lots of user reviews to give you confidence. Okay, so just to summarize, the 6 steps, like what do you do with all of this? There's so many things to do, and what do you do first? So I just put together 6 steps for businesses to determine and prioritize reinvention actions. So number 1 is survey how competitors and analogous businesses in the US and globally are tackling different aspects of the shift to digital for ideas and inspiration. And then understanding what aspects do customers care about most and are most concerned with, because certain ones matter more, and then you should focus on those. So assess the lowest hanging fruit. What is easy to do? What is inexpensive to do? What is quick to do? And then identifying and evaluating new technology options that are currently available or may come on the horizon very quickly. Very important to make clear who in the organization will be responsible for each new task, because sometimes there's a lot of confusion and there's a lot of change. And so if the organization really knows roles and responsibilities, things will be much more efficient. And then establishing plans with the sequence of changes to be implemented, the interfunctional teams involved, what % of the efforts are going to be focused on new tasks versus previous tasks, and then figuring out what are the best metrics to see if you're improving, if customers are liking the experience, etc. Whoops. So that's the last thing on this is just the takeaways. So the post-COVID-19 environment is extremely overwhelming for businesses. Everyone is trying to rethink how to provide these services more safely, quickly, effectively, digitally, and affordably. It's critical that the organization employees, many who are scattered physically, understand priorities, roles, and timing so that there's good communication. And in the mad scramble to cope, survive, and adjust, there's a tendency to shortchange the upfront benchmarking and analysis to make sure that you're focusing on the right approaches rather than just doing, just in crazy rush, doing whatever you can. So to some extent of what's really going to make a difference, what's going to matter to consumers, what can you do affordably and quickly and well. So that's the end of that. And now the next section is very interesting, innovations arising from COVID-19. My book has 63 different types of innovation. It's kind of a random number. I went around the world taking pictures of anything that I saw was innovative, and I saw many times it was one key idea. So I looked at what was the primary innovation, and I've related this to healthcare. So if anybody's interested in the book, it's available for $14.99 on the iBooks store. And I have, again, these are the 63 different types of innovation. First one I'm going to deal with, I don't deal with all of them. I have maybe 10 examples, but metrics innovation. So 2 aspects of metrics I found particularly interesting is that they've discovered that Wuhan appeared in, that coronavirus appeared in Wuhan much earlier than initially expected. And the reason they found that out was they took satellite photography of hospital parking lots. And this is a comparison of the number of cars in October of 2019 versus October of 2018. And you can see a very, very, very big increase. Another interesting example of metrics innovation is looking at search terms. So they looked at 3 of the key search terms for coronavirus, which were cough, diarrhea, and symptoms of diarrhea. And they saw spikes that first started in August of 2019. So again, these are not the usual metrics, but they're becoming increasingly used because they give a different view that's not political. Like, if you're a government and trying to suppress this, you can't suppress this kind of information. Okay, another one which I thought was extremely interesting is partnering of competing drug companies who are trying to come up with the coronavirus. The World Health Organization is initiating a collaborative effort to find a vaccine called Solidarity. And many of the vaccine manufacturers are sharing placebo groups because it's saving on recruiting placebo groups. So I think that's an interesting example. And there's a lot of collaboration of data and analysis so that we can learn faster. Another aspect of this is partnership innovation. is in New York State. Governor Cuomo, who's done an excellent job. He's created basically during the peak one healthcare system where they were combining public and private hospitals all as one, and whoever had need for, if there was overflow in terms of bed need, whoever was under capacity would take that flow. So they were managing the entire system as one, which had never happened before. Number innovation, ventilator tubes. New York, the whole country was in a panic about not having enough ventilators, and they were able to double the capacity with the same number of ventilators by putting 2 tubes on each machine. Another example of number innovation, Time magazine had an issue April 9th about frontline heroes, and they had 5 different covers for the same issue. I don't think they've ever had more than 1 cover for a particular week. So that was creative and enabled them to give credit and admiration and appreciation for so many of the different types of frontline workers. Okay, location innovation, testing and treatment. So I'm sure you've seen this, but testing outside in parking lots. In New York, we were getting kind of creative in terms of where we put our hospitals. So there was a setup in Central Park. The Javits Convention Center was set up to take patients. And then we had the Comfort Ship. And then there was another one that was in Los Angeles, but again, making hospitals on ships. So that was pretty innovative. Again, necessity is the mother of invention. Another example, I mentioned this, but street food. Right now, a lot of streets are being closed off. So streets are becoming restaurants, parking lots are becoming restaurants, etc. Something that I saw on CNN that was very interesting, all the universities, the California school system has announced they are not having campus open this fall. Some universities are, that could change. In Denmark, where they're trying to keep social distancing in schools, which means you need extra space, because if you're taking half the students that you had in the same building, you need extra space. So they've gone to churches that are empty during the day, and the teacher is at the pulpit where the minister would be, and the students are in the pews. They also said they're doing math class in cemeteries because it's fresh air. They're out, out in the open, and there are a lot of numbers on the tombstones so they can give them math problems. Materials innovation, this is pitiful, but when there wasn't enough PPE, healthcare workers were doing whatever kind of makeshift PPE they could, which included large plastic bags. Another example of material innovation, and this is antibody material, but they found that llamas have been pretty resistant to coronavirus, and so they're looking at using their antibodies to neutralize infections. Repurposing innovation. So for face masks, people are taking socks, like there are YouTube videos on repurposing socks. I don't know if you know what a kippah is, but it's the Jewish head covering for synagogue. And there's a YouTube video about how to make a face mask without having to sew anything. Another example of repurposing innovation, there was a woman whose kids were missing their grandma very, very much. So she found online very large, long livestock feeding gloves, and she attached that to a plastic window, to a plastic screen, and she had PVC pipes around it, and she used window sealer to patch up so there were no holes leaking out. So that was very kind of a heartwarming, very nice kind of example of innovation. And then retro innovation, drive-in movie theaters. So that's seeing a renaissance right now. People are just sitting in their cars, ordering food that's brought to them. And then milkmen, because people are staying home in quarantine and a lot of the dairies aren't selling as much to fast food restaurants, cafeterias, things like that. So they're bringing the milk to customers. And then this is my last one, but consumer empowerment, innovation, and that's providing data and facts to consumers. I wrote an article in Forbes about why Governor Cuomo has impressed so many people, not only in New York, but he shared every day the facts, many, many important facts. And just by seeing the progress we were making and what the infection rates were, you know, people were able to judge for themselves, and it really enabled them to take action. And literally people would watch, myself included, every day at 11:30, we'd look to see what the news were and how things were going, because it was so scary here. So it was very effective. So, sorry, have just a couple more. Delivery innovation. This was a vaccine, and there's a new way to get it into your body. Instead of a shot, it's a small patch with hundreds of tiny needles that dissolve into the skin. Crowdsourcing innovation. This was another New York State initiative. They ran a contest because people weren't wearing a mask and they wanted to increase mask rates. So Governor Cuomo's daughters told him he needed to make mask wearing more cool. So they did an advertising contest, and they invited people from all over the world to create advertisements about why you should wear a mask. So that was something that was crowdsourcing innovation. And then alternate product usage innovation, where you have dexamethasone, which was used, had other indications, is being used for coronavirus, and it's already approved by the FDA, so it's able to get to market quickly. Okay, I think this is my last one, business model innovation. This is another example of a dairy that lost distribution because of many different closures, and they reinvent themselves by being a farm stand, and there was a tremendously long line of cars that just came to the store, and they had a window, and again, it was a different model. Instead of going through an intermediary, they were going direct to consumers. Okay, so that's the end. So that's basically it, and we'd love to entertain any questions you have. So Phil, I think we'll help with that part.
Yes, Michelle, I'm going to start with 2 questions, and if you would like to ask a question directly of Michelle, indicate that on the chat or the Q&A, either one, that you'd like to ask Michelle a direct question, and Steve can unmute your mic and you'll be able to ask the question.
Should I stop screen sharing?
Yes, if you want to do that.
All right, let me see if I can, okay, stop share. Okay, great. Okay, great.
And my first question, Michelle, is, and this is from me, is when you were showing comfort foods, was there a particular reason you were showing Cheetos? That just really hit home.
Oh, because the New York Times featured it. I'm full of examples. I don't like to say things that you take my word. I like to have credible sources. But I also have seen the #1 increased food ingredient is yeast. People are baking bread like crazy.
Wow, interesting.
No pasta. I have a former student who has his 5th generation Sicilian olive oil company. I think he sells to Walmart, and pasta sales have been going through the roof, and tomato sauce and olive oil. People are going to what they remember, what's easy to make. That's why I think it's difficult for discovery for new brands right now.
Oh, that's great. The other question is, some of the innovations that that you covered are situational and applied to the coronavirus, but some will be sustained over the years. Is there one that just jumps out to you that's going to be a major shift that you see being sustained over the years that really impresses you from that perspective?
I think working from home is going to be much more increased. I think people are still very frightened about coronavirus, and we don't know how long it's going to be, and we don't know if there are going to be other pandemics. But I think that I'm doing things online that I never did before. I'm ordering more Amazon Prime than I've ever done before. You know, doing more things with Netflix, whatever. And so we're forcing ourselves to learn, and we're realizing it's easier than we thought. And so I think a lot of the digital purchases will be different. I think I used to find a crowded restaurant a mark that it was a good restaurant, and therefore I wanted to go. And now to me, it's a deterrent. I think, there's, different segments of the population, but there are a lot of people that are still very nervous. I mean, frankly, I have students from China, and they tell me their parents are not scared, even though there's been some recurrences, because the government is doing so much testing and tracing that they feel that the government will let them know if there's a problem. We don't have that confidence in the US. And I know there are still a lot of people that are very frightened. A lot of women seem to be more frightened than men. And so I think that behavior of staying at home, realizing it's not so terrible, going out less, public transportation less, flying less. I think there are many, many things that are going to stay. They'll go part way back, but I don't think they'll go fully back.
Yeah. Yeah. And you talked about multi-channel and the impact of that. And I personally experienced that. You can see the Band-Aid on my forehead. And that was I did a telehealth consult with Vanderbilt Dermatology, and then yesterday an in-person visit. And the multi-channel across retail and across healthcare and across so many sectors, I would think that it's not going to be that we just totally shift how we function, but we use new channels and integrate them into our daily behavior. I think it's going to be one of those sustained innovations over a long period of time.
Agree.
Yeah.
Anybody else?
Yeah, I think that, not seeing other questions at this point. We're almost at our 45 minutes. We promised people that we would be out at 45 minutes. I'll give one last opportunity for questions. All right. Michelle, thanks so much. We really enjoyed it. Thanks for your energy and your time, and stay safe in New York. And we look forward to doing other sessions with you. And we just really appreciate your time this morning, or this, I guess it's afternoon in New York.
Right. Okay, well, thank you. It was a pleasure.
All right.
Bye-bye.
Bye, everyone.
Just a second, if you can hold on, we do have some questions coming in.
Okay.
We do?
Okay.
They're in chat.
All right, I'm seeing it now.
Chat. Oh,
Yes.
okay, good. Are there major trends in emerging markets? Okay. Yeah, emerging markets are having a lot of the same problems. They don't always have the ability to go do the technology, but some of them do. Like mobile phones are very prevalent in a lot of emerging markets, so they're probably doing more on the mobile phones. There are very cheap phones, like $20 phones in Africa and India, certain countries. The distancing, I'm finding, it depends. Like I know people in India, and they're doing a remarkable job. Like I'm amazed by the size of India and the size of China and how they have managed to control their population. There are other markets like Brazil, but part of it's due to the leadership. It can be an emerging market where the leader is frightened and really instills discipline in people. In Brazil, I think the judge in Brazil just told Bolsonaro he needs to wear a mask. Literally, he was told by the judge. Brazil is a disaster. Much of South America is a disaster. So you're having issues of job loss, people dying. It's all very scary. So, but in general, I think it's all the same trends of using technology more, social distancing more, online. I don't know about, education is going to be very interesting to see what happens with kids going to school. But I guess that can be hindered. It's a lot of the same trends. And again, I think it's largely related to the leadership and how they can control the populations and distancing. It's hard in a favela, in a slum where everybody's on top of each other. It's particularly difficult. But anyway.
So, Michelle, I would just comment, and I may be mispronouncing your name, but Jokia, who asked that question, is actually from Kenya and has worked for one of those telephone companies that you just mentioned. So the question is very relevant as you were describing it.
Mm-hmm. Okay. Can we expect more business model innovation because of social distancing? Yes. I think, everybody, what's good is this is another phenomenon. I interviewed someone yesterday who works for Google in analytics, and he covers luxury goods, consumer packaged goods, and beauty. And many companies who never would go direct to consumer, like Pepsi is selling products directly from their website. I think Kraft is selling products directly from their website. Impossible Foods that makes the Impossible Burger, they just set up direct to consumer sales. That has a much better margin because if you don't have to pay the intermediary for the mass channels, Target, Walmart, Kmart, the Kroger, Vons, whatever, you have to pay them 25%. They make a 25% margin. For luxury goods, it's a 100% to 200% markup. So if you can sell direct to consumer at the same price, you can capture those sales. There'll probably be more store closings. If you can shift your business online, great, but you might be losing out. So I think that's the biggest business model, is the difference between direct to consumer and going through intermediaries.
And Warren is asking about text messaging and telehealth, teleshopping, and how those platforms will grow. Particularly, I think part of the question relates to text, which maybe hasn't been as much a part of that in the past.
Yeah, I'm not an expert on this, but I definitely think it will increase. And one of the questions is, to me, the value. Like, do consumers feel it's the same value as going in for an office visit? Can they charge the same amount? I think it's probably more efficient from a doctor standpoint. They don't have the overhead of all the nurses and people to check you in, and the waiting room and all the space, whatever. So I think it's actually more economical. In many ways, going online is more time efficient and lower overhead. So I think there will be a migration. I know I just became a grandmother 3 months ago, and my daughters had online consultations with the pediatrician. So I think that's totally going to keep growing. And then analyzing data, having your data, ways to monitor the key health metrics at home, send that data to your doctor or whoever is monitoring. And I think that's going to just keep skyrocketing. Phil made a comment that I think you said in some categories like telehealth and others, that this has been accelerated by 10 years. COVID has really accelerated tremendously. And I totally agree with you.
And another question is, because of that, all of the innovation are there going to be expectation of faster ROI?
Oh, hard to say, because, the economy is so bad. So what are people going to spend on? That's the thing. I have not bought an item of clothing. I haven't need to. That's another thing, because you're at home. You don't need a lot of things. Okay, I have not spent hardly any money on restaurants. There's so many things that I haven't spent money on. So if people are not spending money, if they're insecure, if they're, in the US, we have over 40 million people who have filed for unemployment insurance. Some of that will come back, but people are very nervous. We don't know how long. There's so much uncertainty. It's kind of been amazing that the stock market has done as well as it has. But the bottom line is, it's hard to say about the ROI, because I don't know what people are going to be spending on. I think for technology, maybe great. For other areas, I'm also very leery about real estate, because I don't think too many businesses are going to want to be opening stores and restaurants in this environment when they have such lower capacity. So yeah, I think that's going to be an issue. There's going to be a lot more vacant storefronts. Ultimately, that may reduce real estate prices.
Yeah, and another question related to that is specifically related to mobile money being and cashless payments being popular and high usage in Kenya and Africa, and just the extent to which that is evolving here in the West.
Yeah, well, I've seen that coming anyway. Like now, many stores, at least in New York, you can't pay cash, because they found that cash takes more time. And so so many places, little coffee shops are just going to cashless. So I think that probably will accelerate also, because it's very hard to do contactless payment with cash. So yeah.
And Irma just sent us a link to the health tech companies in Helsinki that are addressing the COVID-19, just some really interesting work happening there. We truly have had an international audience this morning. The questions have poured in just in the last 2 or 3 minutes. Thank you for those questions. I believe we have covered most that are there. Again, Michelle, we've run over just a little bit, but thank you again for your time, and we look forward to doing sessions like this again. We really appreciate your contribution this morning.
Thank you very much.
And thanks to all the attendees.
Thanks. Bye-bye.